Hi everyone, I'm Lauren McCafferty.
And I'm Jason Taranisa.
We're from the Department of Emergency Medicine, and given the COVID pandemic, our goal is to provide a quick refresher on how to perform basic lung ultrasound.
So the first thing we'll go over is probe selection. When you're selecting the probe, the best one to use is a curvilinear probe when looking at the lungs. Gives you the best assessment of the entire lung field as well as the pleural line. If the curvilinear probe is not available, the next best is the phased array probe. If neither of these available, the linear probe is okay for looking at lungs, but really one of these other two are going to be a better option to assess the entire lung field. The linear probe, however, is the best at looking at the pleural line superficially.
So we're going to talk about the 12-zone technique. This involves 4 anterolateral zones as well as 2 posterior zones, and it's 6 zones total on each side for a total of 12. Just keep in mind that the more lung you scan, the better, but this is a good starting point for a thorough lung evaluation.
So for zone 1, this is going to be the most anterior and superior zone on the chest. It's important to remember for every zone you're scanning, the probe marker should be towards the patient's head, and also make sure that the probe itself is perpendicular to the skin. This is important when you're sliding laterally. Remember that the chest is like a circular structure, so you're going to end up angling the probe. Just make sure it's always perpendicular to the skin.
So this just demonstrates kind of what you're looking at. The ribs will appear in cross-section and will appear as shadows. In between the rib shadows, you'll see the pleural line, which is the bright white or hyperechoic structure. In a normal lung, this will appear thin. It's very regular and moves with respiration. You also want to remember to keep a depth of about 15 to 20 centimeters in order to get a thorough assessment of the lung itself.
So here's a picture of zone 2. So this is just sliding slightly inferior on the chest. You're still on the anterior portion of the chest, though.
This is zone 3. Here you're moving a little bit more laterally and you're in the mid-axillary line.
Zone 4, again, you're just sliding down more inferiorly. You might catch a glimpse of the diaphragm in this zone, but mostly you're still mid-axillary line lateral on the side of the chest.
Now moving posteriorly, if possible, have the patient sit up. If the patient is also able to lean forward, this will provide a better assessment. Remember, you're scanning medial to the scapula and kind of heading toward the transverse processes.
And then zone 6 is pictured here, so you're sliding more inferiorly. It's important to remember that most of the pathology tends to be in the area of zone 6 just because that's the base of the lung and most dependent portion. So when looking here, it sometimes helps to kind of scan throughout zone 6 to get a couple different pictures for more comprehensive evaluation.
So to summarize, you'll use the curvilinear probe. You'll have the indicator pointing toward the patient's head. Keep the probe perpendicular to the chest wall, regardless of where you are on the chest. Remember, 6 zones on each side for the total of 12. And identify the pleural line. And then once you do so, you'll assess for pleural thickening, irregularity, as well as B-lines. If you have any questions, feel free to email us at uhcmcultrasound@gmail.com. Thanks.